Now to talk about your family and the major decisions that come with aging. Hospice is one of those, and Carolyn Richardson and also Erin Young are here with help. Thank you both so much for coming in today.
Thank you.
We appreciate it. You know, a lot of people hear hospice, it makes them very nervous. Can you explain what it is?
Right, and I love to speak about hospice. The reason why is it does have a very negative stigma, and I like to remove that from people's minds, because although hospice is for somebody who's actively dying, it's not just for those people. Really what it is Medicare created it as a medical management team outside the hospital setting to really be able to be proactive and preventative with these people who perhaps there may be no cure or aggressive treatment that is going to change the course of their decline. So having this team come into their home, focus on their care, give them that extra above and beyond care, allows them to have a large amount of comfort, dignity, and just care that they need in the home.
Now, what about choosing your hospice? What do you mean by being able to do that?
Well, there are a multitude of hospices here in Arizona, and unfortunately a lot of times people just, when they need hospice, they're just sent, a case manager will just send a hospice in and not necessarily give choice to a family, or perhaps a family doesn't know what to choose or how to choose and they just take what's given to them. I always advocate for people to interview different hospice companies to find ones or one that have that effect on their life, that does the above and beyond care, that they feel comfortable and get a good feeling from.
Right, it's that connection that
Absolutely.
they have. And I know, Erin, you're from Reflections Hospice, a PACE sponsor. Tell us more about Reflections.
Reflections is very different than any other hospice there is, and we strategically do that because we want people to understand that not every patient is the same and not every hospice company is the same. We have a full-time dedicated medical director who really values someone's life. He will do things above and beyond, still within Medicare guidelines, but that will provide the patient the best care that they ultimately can receive. He will go out and make visits and meet his patients. He will order specific testing like labs or antibiotics to make sure that a patient is not in pain and they are in the best state that they possibly can be in at that time. We also own our own DME company, so when our nurse goes out and does an evaluation for a patient needing hospice, we can determine what that patient needs to provide them the best quality of life that they have at that time. So there's a lot of different things that set us aside from all of the other hospice companies in the valley, but hands down, Reflections Hospice is the best hospice there is.
Well, and that's why you say, you know, if you're looking around, this is a superior choice. So how can we learn more?
You guys can call Reflections Hospice at any time, and there will always be someone that can answer the phone 365 days a year. Or somebody can go to our website at reflectionshospice.com.
Okay, and that's just one way. Of course, PACE can also help find you the hospice that you're looking for.
Absolutely, and we will help advocate for families and patients when they're in the hospital for their choice. We will give them different questions to interview different hospice companies with and just help navigate them through the whole process and give that true explanation to family members as a team what hospice truly is.
Yeah, and of course, you can learn more online, on the phone, face-to-face. All you have to do is go to seniorhousing.org or call the number on your screen.